Some big changes coming. I mean, it's no secret that Manitoba's child welfare system is in crisis. We've got some of the highest numbers anywhere. Is there a benchmark to reduce the 11,000 kids in care?
You're right. There is 11,000 kids in care. That's the most of anywhere in the country. We know the number of permanent wards. That's where the state of the province has been mom and dad, I guess, essentially for those kids. There's 60% of them in the system right now. We know that the numbers have gone up dramatically in terms of the outcomes. The amount of kids in care has gone up by over 85% over the last decade. And the amount of days in care, which is a really important measure as well, has gone up by over 73%. So we really need to make some changes. And so that's why we're excited about the reform package we put forth together. What we really want to do as a province is reduce the amount of children that are in care, reduce the days in care. We also really want to provide, if reunification with parents is not possible because of safety reasons, we want to provide lifelong connections. And I think that's really what's missing in the child welfare system right now. You don't have that long-term commitment attachment that you may have with your mom and dad. They're teaching you right from wrong. So if we can provide some supports and services, and this is what this plan does, to provide some aspect, whether you reunify with parents for safety or you're able to provide some supports through a subsidized guardianship process, we're providing supports and services for people to take on a lifelong connection with these children, we think we're going to see some better results. And that's really evidence-based approach that's really worked in other jurisdictions. And so we want to copy that. We want to provide supports to really build that lifelong connections. We think that's going to make a difference in terms of reducing the amount of children in care as well as the days in care.
Now, part of this plan is to ease the threshold of when or how children are apprehended. How are you going to do that?
Right. Well, we're going to review, we're doing a legislative review on the whole CFS Act. That's a huge piece of legislation, kind of the overarching legislation that is a part of the CFS system, as well as the authorities. And that's kind of the governance structure of how we're delivering the services. We know we haven't seen success, and there's the amount of kids in care just demonstrate that we need to make change. So we're going to be reviewing all aspects of that. What we'd like to do is review the CFS system. You're right, there is a process of how children are apprehended. We're going to look to see how other provinces are doing that. Our utmost number one priority is making sure that children are safe, but for sure there is way more children in care in Manitoba versus other jurisdictions. We also, again, want to build supports, permanent options, what we're calling, to really to provide an earlier intervention and providing more supports and for things like agencies and Indigenous organizations. What they've clearly told us is if you're able to invest in things like early intervention and prevention before children get in care, that's going to really make a difference, and the evidence really bears fruit. So that's really what our plan does. It provides supports for reunification with parents, if that can happen in a safe process. If that can't, we need to build lifelong connections through things like permanent guardianship and adoptions. Those are things that we think will make a difference, and the evidence suggests that the outcomes demonstrate that it means a difference for a child. So that's really the focal point of this plan. We also know that a lot of the community organizations are doing a pretty good job, and we need to embrace with them, work with them, provide some flexibility in terms of how we're funding this. You know,
this is that block funding that you're referring to. This is getting a lot of praise from some of the service agencies that are dealing with these kids. How is this going to see results?
Well, right now in the Child and Family Services, the way agencies are funded is the amount of children that are in care and the days in care. That's how essentially they're paid. That system isn't really working well because what happens is a lot of times agencies will say we need to take children, apprehend them to get the services and support that they very much need. If we're able to provide a block funding, that gives more flexibility to agencies and organizations to invest money in things like prevention and earlier intervention, things like family reunification that we know make more of a difference. And so that's something what the Indigenous community has talked a lot about, the agencies have talked a lot about. Our plan is initially to do 4 different agencies in the first year and move up to 14 and have the whole 26 different agencies that deliver services and support in the child welfare system move towards a block funding. And again, that provides flexibility so they can invest in these areas that really make a difference. Prevention, prevention, early intervention, and services and supports to reunify parents with their children in a safe way.
You mentioned the Indigenous population. I mean, 90% of those 11,000 kids in care are Indigenous. Block funding, I'm taking, is one of the ways. What else are you going to do to address that issue?
Well, we have a partnership agreement with an organization called Mumaway. What that is, they're proposing, it's an evidence-based process where it looks to reunite parents with vulnerable children that potentially would go into care. It's called family group conferencing. The families get together, develop a care plan that works for the individuals. What this has shown is that upwards of 70% of the time, we're able to reunite the parents. Again, we want to make sure it's done in a safe way, and so we think partnerships that we're having with good community organizations that's shown some results. You know, the whole process needs to be generated by evidence, the stuff that's really working in the community. So that's really what this plan is about, providing some more flexibility for earlier intervention and prevention, providing some more supports for lifelong connections so you can have that attachment. The results, clearly demonstrate through some of the evidence that's been done that if you're able to invest money in the early years in prevention and early intervention, it's going to make a difference for individuals. And so really what that is, that's a big part of this plan.
There's been lots of calls for this to happen a long time ago. A lot of people feel this is long overdue. When do you hope to see results? I mean, I know this is a lot still in the planning process, but when can we start to see change, do you think?
Well, a lot of the process is happening right now. We've changed to this funding model that will provide more intervention, prevention dollars. That's happening right now with existing agencies. We are introducing subsidized guardianship. It's something where we're taking supports that would happen in the foster care system and giving to parents that want to provide a lifelong connection. We'll be introducing legislation very soon on that. We're also having a legislative review that again looks at the overarching legislation of the Child and Family Services and the authorities of how this is governed. We anticipate making some changes. A report will come back to myself, being the minister. We'll be out in the community talking to individuals, making sure that we're getting it right and making the most effective changes. We hope to introduce that legislation later on this spring.
All right. Thank you very much for your insight into this very important topic.
Thank you.